Imagine this scenario. You have just undergone a routine health checkup, maybe as part of, say, pre-employment evaluation, or as a formality for international travel for visa purposes, or in pregnant ladies as a routine antenatal checkup, sometimes with voluntary blood donors, or just as your annual health checkup. You were totally fine. There were no symptoms, no abdominal pain, no jaundice, no vomiting, no fever, and you thought everything is going to come normal. And as expected, next day when you get the reports, most of the things are normal, but one report catches your attention: HBsAg positive. Then starts the whole panic. What is HBsAg? What is hepatitis B? Is my liver failing? Is my family at risk? In the pregnant lady, what about the kid? Will the baby have any issues? What exactly needs to be done? And then so many online searches, questions, facts, misconceptions later, the patient lands up for consultation. So hello friends, I am Dr. Piyush Chaudhari, and in today's video I'm not going to give a lecture about what is hepatitis B, or what HBsAg positive means or anything like that. But today what we are essentially going to go through is the kind of conversation that we tend to have with our patients who come to the clinic with a HBsAg positive report. So definitely you stay with me through this video, and I'll be addressing most of the common concerns which are in a person's mind when they suddenly find this HBsAg positive report during their routine health checkups. So the very first question which the person asks is, Doc, is this something really serious? I read so much about hepatitis B and HBsAg online. Where do I fall in all that? Well, there, the very first thing which I tell the patient is that don't panic. Let us first understand that HBsAg, which is nothing but hepatitis B surface antigen, or Australia antigen as we call it, and it is just like maybe a cover or a title of a storybook which tells you that this story is about hepatitis B, but it doesn't tell you what is inside that book. So what I mean essentially is that just having a HBsAg positive report points that such a person is having hepatitis B infection, but we do not know further details about that infection with that single report. Like whether the infection is acute, as in having occurred in last few days to few weeks, or whether it is chronic, meaning it is going on for more than 6 months in the person's body. It doesn't also tell us whether there is any liver damage which has already taken place, or the person's liver is absolutely healthy. It also does not tell us on its own whether the person requires any treatment or not, and whether the person is going to have any serious health issues in future or not because of this particular infection. So having HBsAg report positive during a routine checkup just means that such a person should undergo detailed evaluation to know which of the two main categories of this infection that person falls into. Because many of the patients with HBsAg positive status do not require any treatment. Yes, they do not require antiviral treatment. Yet, some of these patients can end up having chronic liver disease, liver failure, that is cirrhosis of liver, and a few of them can even land up with something as serious as liver cancer. So after knowing this, the person almost always says, but doc, I feel totally fine. I do not have any symptoms. So should I even be concerned about this? Well, the important fact here is that with hepatitis B infection, many people remain relatively asymptomatic for a long period of time, sometimes even years together. Because in many of these people, the viral activity is so low that the virus is not able to damage the liver cells, causing any inflammation, necrosis, or fibrosis, or any chronic liver disease or cancer. But in some of these patients, all those effects can occur. Now the problem is that because most patients remain relatively asymptomatic for a very long period of time, they are not even aware that they are carrying this infection in their body in different stages. Maybe some may be inactive, some may be active, and so on. So although hepatitis B can be occasionally detected in patients presenting with acute jaundice, as in like few days history of fever, body pain, followed by yellowish discoloration of eye, skin, and urine, and such a person gets admitted and gets detected with acute phase of hepatitis B, or in many other instances, it is detected while evaluating patients with chronic liver disease or liver failure, like what we call medically cirrhosis of liver, and in few cases of liver cancer. But these are not the most common scenarios when a person comes to me with hepatitis B report. Actually, contrary to all these medically and clinically significant conditions, the most common situations where patients come with a HBsAg positive report are actually routine health checkups. So like I told, the checkups done before surgery, the checkups done in pregnant ladies during antenatal visit, the checkups done as a part of routine annual health checkup, pre-employment checkup, or prior to international travel when certain set of tests may be necessary or mandatory. So essentially, the commonest person walking to the clinic with HBsAg positive report is actually a asymptomatic person. But then this also provides with an opportunity to find out which of these patients are at risk of getting a significant liver disease in future and requires treatment versus those who do not require this evaluation. So naturally, for a person who is asymptomatic, the next question is, do I really have to take this seriously? So here we need to understand how this hepatitis B virus behaves inside our body. So essentially we can talk of two different pathways. One way where the viral activity is extremely low, or where our immunity has suppressed the viral activity or multiplication so much that the virus is not able to damage the liver cells, leading to any sort of jaundice, chronic disease, or any cirrhosis. But in the second pathway, when this tussle between virus and immune system is won by the virus, we can say that the virus keeps on multiplying into multiple copies, thousands or lakhs of copies every day. The virus starts damaging the liver cells subtly, and over a period of time, this damage can lead to inflammation, necrosis, and fibrosis, that is stiffening of the liver, eventually landing up with cirrhosis of liver, or what we call as liver failure. Now, a small percentage of patients from this group can also end up converting into liver cancer. So, to give you a perspective, if we see in India or even globally, along with alcohol related liver disease and the metabolic entity of fatty liver related liver disease, hepatitis B, that is the chronic hepatitis B infection, still forms one of the three leading causes of chronic liver disease. In fact, even now, almost 40 to 50 million people in India are estimated to be positive with hepatitis B, many of them entirely unaware about their HBsAg positive status because of not having any symptoms as yet. If we see the proportion of patients with cirrhosis or chronic liver disease, almost one third is because of chronic viral hepatitis like hepatitis B. And from reliable cancer registries, like from places like Tata Memorial Hospital or other such apex cancer hospitals, almost 40 to 45% of liver cancer cases are attributable to hepatitis B, which is essentially an infection which can actually be treated and also potentially be prevented. So after knowing all these things, the next important question in the person's mind is obviously, how did I get it in first place? So here it is extremely important to understand that hepatitis B does not spread through food and water, unlike our other typical viral hepatitis like hepatitis A and E, which spread through contaminated water and food and cause the routine jaundice that we discuss in day-to-day life. But hepatitis B spreads through high-risk sexual behavior, blood contact, spread from a positive mother to the child if she is not treated appropriately and well in time. Then it can also spread through infected sharp instruments like say needles or syringes in people who use drugs, or even unsafe tattooing or piercing practices if disposable sharps are not utilized. I mean, previously, maybe a few decades back, even blood transfusion and surgical instruments could have been an important source of spread of hepatitis B, but that is not so much of a concern in recent decades. Now, along with all these routes, it is equally important to understand that hepatitis B cannot spread from one person to another just because of staying in the same house, eating together, sharing food, sharing utensils, using the same bathrooms, sleeping in the same bedrooms, and so on. So, routine day-to-day casual contacts do not spread hepatitis B unless the instrument or the contact is in form of some sexual activity or something contaminated with the infected person's blood. So this is extremely important so that any person who is HBsAg positive does not isolate himself or herself, and they can lead normal healthy life with all their family members without putting anybody in the family at risk. So naturally, the next essential question is what should be done for the family? So now here, in the family of a person who is HBsAg positive, especially with that person's spouse, that is wife or husband, or with the kids, it is important to know one, whether they already have infection, which will be by screening for HBsAg, the same test which was done for this person. Second, if they do not have HBsAg positive status, then whether they are still susceptible. So susceptible meaning somebody who does not have infection and is not vaccinated either. So if they are not vaccinated, then obviously they should receive simple 3 doses of vaccine which costs less than 100 rupees per dose, and with the 3 doses it gives almost 100% lifetime protection against this infection. As far as marriage and having kids is concerned, a person with HBsAg positive status, if the viral load is totally controlled, can very well marry and have kids naturally without the risk of their husbands or wives getting infected, or without the risk of spreading it to the child. Supposing, like we discussed in the initial scenarios, a pregnant lady is detected with HBsAg positive status, proper evaluation to find out whether she requires antiviral or not, and then giving her that treatment, along with giving anti-hepatitis B immunoglobulin to the newborn within 72 hours of birth, followed by the 3-dose vaccination schedule, can protect the child in more than 99% of cases, and the child does not get transmission of hepatitis B vertically from the mother during or immediately after the childbirth. So then the person definitely asks, okay, fine, now I understood, but what should I do when I've already got HBsAg positive? So that is the most important part of this whole discussion. If anybody is detected HBsAg positive, then we do further evaluation. First, related to the virus itself. So hepatitis B viral load, that is the quantitative DNA PCR, which tells us what is the number of copies of the virus in that person's blood. Secondly, something like a hepatitis B envelope antigen or antibodies against that antigen, which tell us whether the virus is actively replicating or not. The next part is obviously assessing the person's liver, whether it is healthy or not. So that can be by 2 ways. One, by doing liver function tests, especially the ALT and AST like liver enzymes. And second is by doing ultrasound, or more importantly, FibroScan, which is a non-invasive way in which it can be detected whether there is any inflammation, necrosis or fibrosis, that is stiffening within the person's liver. Now with the report of all these factors, along with person's age, family history of any liver cancers or liver diseases, and other medical conditions which can predispose that person to liver problems, a decision can be arrived at whether that person requires antiviral or not. Even if the person is in the category where the viral activity is very less or not present and no antiviral treatment is required, such a person definitely requires monitoring for several years to come, because the viral activity can increase at times and can start causing liver damage. So if we pick it up well in time, it can still be addressed at that point of time. In the group who is eligible for treatment, as per all these reports, still monitoring is required to find out whether the liver health is maintained or whether there is any chronic ongoing damage. Now the natural question here is how long to take treatment. Now unfortunately, most of the people who require antiviral treatment require it for several years and at times lifelong. But fortunately, a small percentage of these patients can entirely convert HBsAg negative and have completely suppressed virus, where treatment can be discontinued after a few years. And even in those where lifelong or multi-year treatment is required, The currently available antiviral drugs, which is just a single tablet per day, are extremely effective in controlling the virus and its effects, and also have very negligible side effects compared to the treatment which was perhaps available 2 or 2.5 decades back. So through all this discussion, the person often feels, if there is a vaccine, then how come I didn't receive the vaccine, or how come I still got the infection? Well, this is extremely crucial point as far as at least Indian population is concerned, that the hepatitis B vaccine became available to us somewhere around the early 2000s, and over the subsequent 5 to 7 years, in a phased manner, this vaccine was included in the universal immunization program for newly born children. So currently, all newborns, along with their polio, BCG, DPT, and other vaccines, they receive 3 doses of hepatitis B vaccine, giving them adequate protection against this important infection. But those who are born before the early 2000s, which still forms a significant population in our country, are still susceptible. Therefore, it is very important among those people to know whether they have voluntarily taken the vaccine afterwards. If they have not, then check your HBsAg status and get vaccinated if you are still susceptible. So friends, from the anxiety, panic and fear related to finding that HBsAg report in your routine health checkup, after all this conversation, the person goes out from the consultation with a clear plan. Yes, fine, I have HBsAg, but I know what evaluation to be done. If I need treatment, there are effective options available, and there are ways to keep my family protected. And I need not isolate myself or curse myself for getting this infection and keep myself away from my near and dear ones. So if you found this video useful, and if you know somebody who may be in fear, panic, or misunderstanding because of a HBsAg positive report, please do share this video with them. From all this conversation, if I want you to remember just 3 things, then it should be: 1, HBsAg positive report does not necessarily mean that the person is going to have liver disease or require treatment, but that definitely requires evaluation. Second, a person with positive HBsAg report can still lead a normal healthy life if properly evaluated and treated. And third, most importantly, the close contacts of such a person can be screened for infected status or susceptible status, and if they are susceptible, infection can be prevented by simple 3 doses of a very effective anti-hepatitis B vaccination. So friends, remove the fear and misconceptions about hepatitis B, be aware about it, and evaluate if you are found HBsAg positive. Stay informed, stay healthy.